get worse.
Dr. Anthony Fauci there basically saying things will get worse. Joining me now is Democratic Congressman Raja Krishnamoorthi, a member of the House Oversight Committee. Congressman, thanks for joining us on this. Quite a day for you.
Yes.
Let's talk through some of the points that you guys covered in this testimony. You asked the director of the CDC, Dr. Robert Redfield, about the pace of coronavirus testing here in the United States versus other developed nations, such as the UK and South Korea. Here's some of what he said, and I want your reaction on the other side.
I think one thing I would like to point out again, the CDC developed this test for the United States public health system. We did not develop this test for all of clinical medicine. The test for clinical medicine, we count on the private sector to work together with the FDA to bring those tests to bear.
So in a way, he's kind of passing the buck there to the private sector as well, or wanting to share the blame, I guess, with the private sector?
Yes. Basically, just to kind of level set where everybody is in terms of their understanding of what other countries are doing versus us. South Korea, interestingly, contracted its first coronavirus case on virtually the same day as the United States. They developed their test on basically virtually the same day as the United States. But now they have completed almost 200,000 tests of their citizens, diagnosing whether or not they have coronavirus. Here in the United States, we have not completed even 5,000 tests for a country that is 6 times the population of South Korea. And the problem is, here, unlike in South Korea, we have basically delegated much of the testing, as Director Redfield said, to the private sector, LabCorp and Quest, which are the largest testing companies. But the problem is they have zero accountability to the federal government and the CDC, and so we can't even validate whether their tests are correct. So this is a situation that is very unfortunate, because we got to test a lot more people fast.
So let me ask you this, because what actually needs to change with this situation in order to get more people tested, if in fact there are so many other people walking around, as so many people have told me, that are asymptomatic but positive with coronavirus and not necessarily knowing it? I just spoke to NBC's Richard Engel, who is in Dusseldorf, who was with a laboratory developing a test there, saying this thing, they could get results of coronavirus testing within the hour, but because of the regulations by the FDA, they can't get this thing stateside. It seems as if they had that testing here, we'd be able to get a lot more testing done. And by the way, nobody is arguing the FDA shouldn't have these high levels of regulations, but in times of emergency or possible massive outbreak in this country, it seems like maybe there should be an emergency lever in place.
That's right. I think that that's one thing that has to happen, which is the FDA needs to be flexible in the way that it works with different labs and different private sector entities to make sure that they can get these tests out rapidly and performed rapidly. On the other hand, the CDC must take a central role in making sure that we do what's called national or community surveillance, that is testing people who may not even be symptomatic, but we want to make sure that we prevent community spread. If we're not able to identify everybody who has the coronavirus, we're not going to be able to get ahead of the virus, which is spreading every day. We can get ahead of it, but we can't be complacent. And the feeling that some of us got listening to some of the experts from the Trump administration is that they might be slightly flat-footed right now, but we have to be the opposite right now.
Congressman, I want to get this in because it's an important one. Your colleagues in the Senate laid out the top objectives in their emergency coronavirus bill. Here's some of what made the list: 6 months of flexibility for federal student loans, disaster grants to help local economies, public transit assistance, child care center grants, emergency unemployment and paid sick leave, and it goes on. You see the list there up on your screens. Is this something that you think could actually get through, and do you think it's missing anything? What about just straight cash for those individuals that are wage workers that would feasibly have to stay home if their children aren't able to go to school and they need to keep their lights on?
Right. And there are some public relief programs that I think need to be beefed up, and certain regulations that the Trump administration has introduced, for instance, with regard to food stamps or SNAP, which quite frankly have to be suspended because they basically are kicking families off food relief at a time when they're probably more food insecure. Another thing that has to be in the mix is we have to make sure that the cost of testing and treatment is not a deterrence to anybody, whether they are uninsured or underinsured. It turns out that upwards of 45% of American adults are uninsured or underinsured, and so they are less likely to go and get tested. But if they don't get tested, they're going to get sicker, and they're going to expose the rest of us to the disease.
We'll leave 20 million Americans right now without insurance. Congressman Roger
Correct.
Krishnamoorthi of Illinois, thank you so much, Congressman.
Thank you so much, Yasmin.